Failed embryo transfer? These are the things that you can do to increase your odds of a successful pregnancy with your next embryo transfer. My name's Jess. I'm a certified nurse midwife and infertility mom. I post new videos every Thursday about infertility and recurrent pregnancy loss. So like, subscribe, turn on the notification bell so you don't miss an upload. We had our first frozen embryo transfer at the beginning of October, and though everything seemed to go according to plan, we wound up with a chemical pregnancy, meaning that the embryo stuck briefly but then didn't continue to grow. While we are eager to try again, we are a little bit nervous and we want to do something different this time. Fortunately, we have a wonderful reproductive endocrinologist who heard our concerns and gave us a lot of helpful suggestions. The first option you'll want to consider is doing pre-implantation genetic testing on your embryos. We already did this with all of our embryos, so it won't change everything for our next cycle, but if you have frozen embryos left over from your previous egg retrieval, it is possible to thaw them, have them biopsied, and refreeze them while you're waiting for those genetic testing results. That way, you can make sure you're transferring a healthy embryo with a normal number of chromosomes. I was just curious if thawing and then refreezing an embryo would make it less healthy or less likely to implant, but I actually found multiple studies that showed when couples did their initial egg retrieval, if they did genetic testing before the first freeze and then used those embryos, they actually had the same pregnancy rates, the same implantation rates as couples who had frozen embryos, thawed them, biopsied them, refroze them, and then thawed them again later for future use. So it's something worth considering if you didn't do it the first time around. Your reproductive endocrinologist may also offer you an endometrial receptivity assay or an ERA, and this is something that can, in theory, help identify the best window of implantation or when to ideally transfer your embryo. For this procedure, you take the exact same medications you would for a frozen embryo transfer cycle. So, for example, mine involves like a few weeks of birth control pills, followed by injections of Lupron, estrogen pills, progesterone and oil injections, and then going in for transfer. But instead of going in for transfer, you would go in for an endometrial biopsy, which is a procedure they do in the office where they take a sample of your uterine lining and they would then send it off to the lab to try and identify the best day to transfer an embryo. The results of the endometrial receptivity assay can either be pre-receptive, meaning that you need more time on progesterone before your uterine lining is ready for an embryo, receptive, meaning that you're at the perfect time to transfer an embryo, post-receptive, meaning that you've spent too much time on progesterone and it's not the best time to transfer an embryo, or non-informative, meaning you took all of those medications and did that whole procedure and wasted a cycle and you didn't even get any useful information. I personally felt like there was absolutely no way my mental health could handle that. Like, there's no way I could go through all of the injections and feel like we missed a month of trying. And our reproductive endocrinologist was like, honestly, it hasn't been shown to increase pregnancy rates. So if you don't want to do this, that's fine. So I said, yep, doesn't sound like it's for us. And I did look it up afterwards after talking with him. And sure enough, all of the studies show that an ERA really does not increase your pregnancy rate. So might be something to consider, but the evidence really doesn't support it. I wasn't personally familiar with the endometrial receptivity assay since it's not something that I order for my patients. So I looked it up after I talked about it with my reproductive endocrinologist, and all of the available research shows that it does not increase pregnancy rates. And part of this is because it can be off by plus or minus 12 hours, and an embryo can linger in the uterus before implanting for days. So even if you pinpoint the perfect day, you don't know when that embryo is going to implant. All of the studies show that it does not increase live birth rates, so we chose not to do this one. The third option is a medication called Depo Lupron, which is used for endometriosis. So if you have endometriosis, you may have already tried this medication. Unfortunately, the only way to definitively diagnose endometriosis is through laparoscopic surgery, meaning that a physician has to have a camera inside of a woman's body to see that there is endometrial tissue or uterine lining tissue growing where it is not supposed to be. Contrary to popular belief, endometriosis will not show up on a pelvic ultrasound. So I've never had laparoscopic surgery. I don't know if I have endometriosis. I do have heavy, painful periods, which is a primary symptom of endometriosis, but there are a lot of other symptoms that I don't have, like pain with sex, pain with bowel movements, or chronic pelvic pain. My reproductive endocrinologist suggested that I could have undiagnosed endometriosis, and they could give me Depo Lupron, which is the same medication they would give to women who have severe endometriosis, as part of the medication regimen for my transfer cycle. But since I don't have other symptoms of endometriosis, I didn't feel like this was necessary and I declined this option. The last option that our reproductive endocrinologist gave us was to add medications that they would use to treat an autoimmune disorder or clotting disorder, and we did elect to go with this option. So throughout our infertility journey, I've had multiple miscarriages, and because of that, I've had testing for autoimmune conditions and clotting conditions, and everything has come back normal. So our reproductive endocrinologist's opinion was something is wrong that we have not figured out. Let's treat you like you have this autoimmune condition that we just haven't diagnosed yet. And to me, that absolutely made sense. I've got this gut feeling that there is something wrong with inflammation in my body. And so I can take prednisone, which is a steroid, to treat inflammation throughout. It'll start when I start taking estrogen pills for transfer. We will also add Lovenox to our regimen, which is an injectable blood thinner. So that would treat any potential autoimmune or clotting disorders. I made a video about testing for autoimmune disorders that can contribute to infertility and miscarriage. So click this link to check that out. If your reproductive endocrinologist offered you different tests or medications after a failed embryo transfer, please drop them in the comments below. I make new videos every Thursday about infertility and recurrent pregnancy loss, and we are getting ready to prep for another embryo transfer. So I'll start medications on November 13th for embryo transfer on December 11th. So please like, subscribe, turn on the notification bell to follow along. Thank you so much for joining. Thank you for watching.